All right, good afternoon. We are reaching the 12 noon timestamp, so we will get started. If you are joining us today and looking for the SHSU College of Osteopathic Medicine CME offering, you are in the right place. Today, our CME offering is going to be presented by Dr. Peter Kurka. Dr. Kurka is an emergency medicine physician in Houston, Texas, and a faculty member here at the SHSU College of Osteopathic Medicine. He serves as an associate professor in the Department of Osteopathic Practices and Principles and serves as the course director for longitudinal osteopathic manipulative medicine course. And we're excited to have you here, Dr. Kurka, to present what today is actually a faculty development presentation and will not be offered for CME credit, but we're going to discuss the current state of osteopathic medical education and the OMM clerkship course that Dr. Kurka provides here at the COM. So we will go ahead and get started. I will share our presentation screen, and then Dr. Kurka, you can take it away.
Okay. Welcome. Good afternoon, everyone. Like Rachel said, I am an emergency physician, residency trained emergency physician, and board certified. And about 15 years ago, I decided I also wanted to get back involved in osteopathic manipulation. So I was able to sit for the boards. And so now I'm board certified in both specialties. What we're going to be talking about today is mostly about the mechanics of our online course. It's required that students have OMM didactics and coursework throughout their 4 years of medical school. We're going to be talking about the history and principles of osteopathic medicine, a little quick overview of the history for people that may not be familiar with it. We're going to be talking about the different types of techniques that are used, and also, again, the mechanics and the format of the online course. And we're also going to make sure that you guys have the contacts and resources you need for assistance. So osteopathic education is very much like medical education in general. It's 4 years, includes basic sciences and clinical instruction. It also includes about 200 additional hours in osteopathic manipulative medicine. Osteopathic education tends to be somewhat more clinically oriented, with a focus on primary care, and utilizes community hospitals to some degree. However, there's education in tertiary medical centers and subspecialty clinics and the like. So today there's about 150,000 osteopathic physicians in active practice. About 25% of current medical students are enrolled in osteopathic schools, and we graduate about 6,000 osteopathic graduates per year. And of course, these people are fully trained and licensed physicians, and they practice in all specialties. During my time in Houston, we've had DO as a chief of neurosurgery at Texas Children's. We've had DOs on the trauma service at Hermann Hospital. And so I think they're pretty well represented in this area. Osteopathic medicine was founded in the late 19th century by a frontier doctor named Andrew Taylor Still. He had become disillusioned with the medical practices of that time and began searching for a better way of doing things. He developed a philosophy of health. He rejected most of the drugs that were available at the time, things like calomel, mercury, and arsenic, and incorporated a system of manual treatment to remove barriers to patient healing. Although he did perform surgery and obstetrics, and as time went by and drugs became available that were more effective, these were incorporated into osteopathic medicine. The goal of the manual treatments is to improve circulation, nerve conduction, improve mechanics, and to relieve pain. And Dr. Still talked about using bones as levers to accomplish those goals. So when people, especially in the broader medical community, when they talk about manipulation, they are often, and it's often termed spinal manipulation, and they're often talking about the thrusting techniques that are sometimes accompanied by popping sounds or cracking sounds, and these are similar to what chiropractors do. And in the osteopathic world, we refer to these as high velocity, low amplitude, and we do use those techniques. However, there's a lot more techniques that are available that are applied by osteopathic physicians. Most of them are much more gentle, although when done correctly, HPLA uses very little force if it's set up correctly. And so what we're going to try to do is give you an overview of what you might see your students trying to do with the patients that they see. So some of these techniques include muscle energy, which is a isometric technique with the patient assisting and providing some resistance, and then relaxation. Soft tissue, which is a passive massage-like treatment, mostly of superficial fascia and muscles. Myofascial release, which is a somewhat deeper passive stretching technique. Counter strain, which is a passive positioning technique, positioning the patient in such a manner that restrictions and abnormal muscle tone can be relieved. Articulatory techniques are a gentle springing sensation of restricted areas, and there are several more technique models that may be employed. We did a survey of our students asking them to rank the types of techniques that they might employ when seeing patients. And it included probably about 40 or 50 techniques, but these were the top 10 that were selected by the students. And so you can see the muscle energy, articulatory techniques, soft tissue, lateral stretching, lymphatic techniques, which are a little bit different, but they're easy to do and they're very gentle. So these are the types of techniques that we think would be most likely that your students will be performing. So the course that they are engaged in right now was purchased from A.T. Still University in Kirksville. It has been used in several different programs. It has been validated and it has been shown to improve outcome on the board exams. It consists of a 3-semester curriculum. These are several modules that students will complete. There are readings, and there's a research reading assignment. There's a manual medicine literature search assignment, and they're required to perform a certain number of techniques. So we ask them over those 3 semesters to do at least 30 osteopathic structural exams, which are very easily integrated into a general physical exam. We asking them to do about 10 of these each semester. These can be performed preferably on patients, but also on volunteers or other students. And then we're asking them to do some OMT technique or OMT treatment procedures, at least 5 in each semester. So this is the general course outline. We've already done the introduction and assessment. They have completed now the cardiovascular module. They're doing these in order. They can, as they finish one module, they can move on to the next, but it has to be completed within this fall semester. And as you can see, this may not correlate with the actual clinical rotation that they're on. So they may be doing, OB, but they're working on the respiratory or the cardiovascular module. So for a typical module, we'll have several subjects it'll address. So in the cardiovascular module, there is the osteopathic approach to lymphedema, to myocardial infarction, to congestive heart failure. There is a research reading associated with each module, and then a quiz. And the quiz is a multiple choice open book that they complete online. So 20 multiple choice questions. It takes, they have 30 minutes to complete it. They do have 2 attempts to successfully complete it. The content includes both osteopathic treatment and conventional treatment, diagnosis and epidemiology, pathophysiology, again, conventional treatments, medications, or other treatments that might be employed, and then osteopathic treatments and the rationale for using those treatments. So again, this is what they do when they're online. There's a little study guide for each module. It gives them pointers on what areas to look at in the body and what kinds of techniques might be amenable or useful for those particular conditions. And they also have access to the required texts, for the course and other online resources in the osteopathic literature. So in osteopathic medicine, we talk about 5 treatment models, or I guess you could call them models of how OMM works. There's a biomechanical model, a respiratory circulatory model, metabolic and energetic model, neurologic and behavioral. And these models overlap, and each one provides a somewhat different look at how OMM and the osteopathic philosophy can be applied to patients. So as you might expect, the biomechanical model is looking mostly at the musculoskeletal system, things as simple as hamstring stretches, or treating what are called osteopathic or somatic dysfunction in, say, the thoracic area or the cervical area, to relieve headaches, areas of muscle spasm and increased muscle tone. The respiratory circulatory model focuses more on improving circulation of blood and lymph, and improving the supply of nutrients and oxygen to various tissues, and then getting those tissues, draining those tissues of metabolites to detox. There are different methods of trying to improve that circulation and to augment it. Metabolic energy model talks about the increased energy demands on the body when things aren't moving well, or for example, the musculoskeletal system is out of whack, ankle sprain that alters the gait, postural imbalance that creates a bigger demand for energy to ambulate. By improving those, you can decrease the energy demands on the body, which is good for overall health. Neurologic model focuses on relieving restrictions on nerve flow, whether it's a tight muscle or a segment in the spine that's not moving, puts pressure on a nerve, maybe decreases nerve conduction. In one area, example might be a carpal tunnel syndrome, or in cervical radiculopathy, where it's related to maybe a thoracic outlet problem. And treating those areas of restriction may take pressure off nerves, allow things to flow better. And we're also trying to treat dysfunctional reflexes. So the thoracic spine has got muscle spasm. On the other end of the spinal nerve, there's a afferent effect on the viscera. So by treating these somatic dysfunctions, we may improve the functioning of the viscera and the autonomic nervous system. Behavior model is a little different. It focuses on the fact that people have bring all kinds of things to the office with them. They have mental problems, emotional problems, spiritual problems, emotional stresses. Sometimes these are reflected in the musculoskeletal system in terms of increased pain, increased muscle spasm. And by treating these areas, sometimes you'll get a fairly remarkable emotional release when these things are alleviated, and allows the patient to experience either the full reaction, grief, or anxiety, or things like that, so that even though we're treating the body, we do have an effect on the patient's mental well-being. We ask the patients to work alone. It is an open book exam. They are aware of the consequences of not following those guidelines. They have, again, their literature review. They're asked to search the osteopathic and the musculoskeletal and manual medicine literature, and they're asked to report their literature search and present it in one of the recognized formats. They upload these to Blackboard, and whether or not they complete this is the goal of that search. They do complete a practice log, and this is where the preceptors may have the most questions. Again, we're asking them to do, I think that's an error there, it should be 10 supervised structural exams per semester. They are to log the date, whether the patient is a patient or a volunteer, their age and sex and chief complaint. There no patient identification information is required. Whether the person supervising is a DO or MD, we ask them to print their name next to each treatment or block of treatments. However, the supervisor only needs to sign this form once. We also recognize that sometimes in a given clinic, the student may not be working with the official preceptor. So as long as the person they're working with is comfortable and they are formally allowed to supervise the student, then they can sign the form. They can also, their name will be listed. We do ask that they get a physical signature. So what I ask them to do is I ask them to print out one of these forms and keep it with them, and maybe they can use the same form for the entire semester, and then once it's completed and signed, it can be uploaded to Blackboard. So this is the form. It looks horrible, but it's really pretty straightforward. The main thing for the supervisor is the right-hand column where there's the printed name, and then the space at the bottom where they sign. The student is responsible for filling in all the other material, what type of patient it was, what techniques they performed, what region of the body they treated, and so on. Again, we ask them not to copy and paste signatures, not a physical signature, which they can then scan and upload. We do ask that they complete these forms by the official end of the semester, and they can, but if they are on a rotation where the dates don't correlate perfectly with the university calendar, they can start logging these treatments a little bit earlier. We ask that they get your permission before they complete a treatment, and that also, I guess, could apply to the structural exam Although again, that is very much just a part of the general physical exam, and it's really very straightforward. They should be able to explain what they're going to do and why they're going to do it. And I was actually on a site visit yesterday, and one of the students had said that what he did was when he was going to perform a technique or perform a treatment, he accessed the videos that are available, and he let the preceptor view that video and gave a better idea of what exactly he was going to do. And I think that's a great idea. I'm going to send out an announcement with that suggestion. We ask that they, again, get your permission and explain, what they're going to do, why they're going to do it, how they think it's applicable to a particular patient. Their grade is based on all the components that we discussed. The 75% of their final grade is the quizzes that they complete. Each quiz is worth about a little less than 20% of the grade. Their literature review and OMM practice are just that they have to submit it in the appropriate format, and they get the credit for those things. Let's see. Oh, and then if I didn't mention already, the course, it's a pass-fail course. So even though they get a numerical grade for the quizzes, the final grade for the course is pass-fail. There are deadlines. Again, these are available in the syllabus for the course. The quizzes have individual deadlines, and then the literature review and practice logs are generally due at the end of the semester. We ask that they please not wait until the last minute, and there are penalties for people that are late or if they don't complete a particular segment. So that is the gist of the presentation. Again, I am the contact person if you have questions about OMM, and from a clinical standpoint, what are the indications, contraindications, what techniques might be applicable in a given situation, and the requirements of the course and the documentation. For more administrative stuff, Dr. Mary Hogan, who I'm sure you all know, and Ms. Mertens would be the appropriate contacts. And hopefully that was useful to you. If people have questions, we've got a few more minutes that we can entertain some questions. And this was recorded, so if you missed it or if you wanted to view it again, it's available. And there will be a brief little quiz that you guys will complete. And we'll just open it up to questions or whatever.
Yes, thank you, Dr. Kirka. We will stay for a handful of minutes. As Dr. Kirka just mentioned, if you have any questions, feel free to place them in the chat and I can read them here for Dr. Kirka. If there are any questions about this presentation after the fact, please feel free to email myself or Dr. Kirka. The assessment link, our Qualtrics assessment, has just been dropped into the chat as well. So we do ask that you please complete that. And for our COM faculty, you will be receiving faculty development credits. But as Dr. Kirka mentioned, we would be happy to field any questions you might have at this time. So far, we're not seeing any questions coming through. I do want to thank Dr. Kirka for presenting today. And it looks like Dr. Alvarez may have a question. I'm going to If you'd like, Dr. Alvarez, I'd love to unmute you and you could go ahead and ask your question if you'd like.
I think that the chat is disabled.
Hello? Yes, sir.
Yes, Dr. Cork, I think the chat is disabled and perhaps that's the reason no questions are being posted.
Oh, okay. Let's
Ah.
just check really quickly. Who can participate in chat? Everyone. Okay, thank you, Dr. Alvarez. We will give a handful more minutes if there are any questions, but if you also have a question, you are still unmuted, so feel free to ask any questions.
To this, Dr. Corka, thank you very much for the presentation and bringing to perspective the 5 different models for the osteopathic medicine as an ODO. What is the expectation that it may have for assessment of the students?
For the assessment by the preceptor of the students?
Correct. So a preceptor that is no ADO, what is the expectation in terms of trying to fill those ROTICs?
I think as long as the students communicate with the preceptor, an MD preceptor, to the extent that the preceptor is comfortable allowing them to perform techniques, and that they supervise the students, see that the technique was performed and there was no adverse outcome, that the students were professional in the way they approach the patient and deliver the technique. I think those are the main that's the main aspect that I would expect to see from the preceptor, and even a DO preceptor. Sometimes whether the technique is successful or not, you don't know for a couple of days. Sometimes people will not feel very different after treatment, and then a few days later they go, "Hey, that feels really good," or "Gee, that really hurts. What did you do wrong?" or whatever. So sometimes the immediate effects are not apparent. So as long as the students are approaching the patients professionally, taking care with their handling of the tissues and the body, that's what we'd want to hear about.
Okay, it looks like Dr. Alvarez mentions thank you so much. It is very clear now. We had another individual ask if there was something that we intended to download into the chat. We will be uploading this presentation to our SHSU College of Osteopathic Medicine YouTube page. So in about 24 hours, you can go back and reference this great presentation from Dr. Kurka. But I've also put in the chat our assessment. We would like you to please, all attendees, please complete the assessment that follows back up on the information found here in this presentation. If there are any other questions at this time, we have a handful more minutes. So we'll hang out for just a few more minutes. For any of our other faculty and preceptors, our CME offerings will be held every second Thursday of the month from 12 noon to 1 p.m. So hopefully there's time in your schedule to join us again for our next CME offering and learning some great content, whether it be from our faculty here at the College of Osteopathic Medicine, or some of our preceptors or our other amazing faculty and staff here at the COM. I'm not seeing any other questions, Dr. Kurka. If you're okay with it, we can sign off. We want to thank again Dr. Peter Kurka for joining us, and we hope you all have a great rest of your afternoon. Thank you so much for joining us.
Thank you.